I'm Rich Kuchman, the Strategic Self-Reliance and Defense, and today we're going to cover the continuing series on TCCC, or Tactical Combat Casualty Care, continuing our March PAWS acronym, and I think we've made it to C now. C for circulation. So remember, watch the video, rewatch the video, come out and train with us. All right, TCCC and TECC are both offered. All right, so remember, the March PAWS acronym is simply a way for us to remember the priority of care, the order that we need to do things for trauma patients. All right. M, massive hemorrhage, stop the bleeding. A, open the airway. R, respirations. We've covered all those videos. All right. We've made it to C, circulation. All right. I have to tell you, there's not a lot we're really going to do unless you're a trained professional. You're an EMS, a paramedic, a doctor, or a nurse, and you've got the gear. There's not a lot to do for circulation, because really what we're talking about with circulation, we're talking about treating shock. All right. So shock is when the organs of the body aren't perfused. They're not getting blood. When our organs don't get blood, they're not getting oxygen, they're not getting nutrients, and things start to die. All right. So that's the definition of shock. It's basically poor perfusion to the organs and tissues. All right. So unless you can do something about that, and that really talks about replacing volume, replacing blood loss, there's not a lot to do in the field. But I'm going to cover what the TCCC algorithm tells us we could do. All right. Just remember, nothing works unless you stop the bleeding. Okay. So that's why M, massive hemorrhage, stop the bleed, is the first priority. You've got to stop the bleed. If you don't stop the bleeding, just giving more volume, more blood, is not going to solve the problem. It might slow things down, slow the process down, but you got to stop the bleed, right? Number one priority, stop the bleed. Number one reason for preventable deaths in trauma is blood loss, okay? All right, so I kind of give you the down and dirty what shock is, poor perfusion to tissues and organs. We've learned a lot in 20 plus years of, OIF, OEF. All right. Now, I remember when I started trauma nursing, pretty much every trauma patient rolled in the door. They got 2 large bore IVs and 2 liters of normal saline or lactated Ranger's crystalloid, what we would call crystalloid fluids, right? Just clear, watery IV fluid. But we've learned that is a poor replacement for blood. When you lose blood, you can't replace it with water. Okay? The best replacement for blood is more blood. So we've changed. We don't do that anymore. We don't just give them wide open crystalloid fluids anymore. So I'm going to walk you through what TCCC, TECC tell you we should do. If we have that skill and we have that equipment, what we do. All right. So the first thing we can all do, and that's just simply assess for signs of shock. Right. So basically, you're trying to determine, is your patient in shock yet, or how close are they getting? Right. And the first most sensitive organ, the brain, right? Are they making sense? Are they having what we call an altered mental status? Right? Altered mental status could be something as maybe a little confusion, maybe a little anxiety, a little agitation, or it could be kind of somnolent, sleepy, lethargic. It could all the way down to comatose, right? Those are all the spectrum of altered mental status. But usually the first symptoms, the casualty might be just a little confused, a little agitated, a little anxious appearing. Okay, so that's altered mental status. Skin signs, pale skin, right? Pale, cool, diaphoretics, clammy as we would call it. If you know how to take a pulse might be hard to find. It might be what we call weak or thready. A very thready pulse is a sign of low blood pressure. If you took a blood pressure, the blood pressure would be low. We like to call normal blood pressure 120/80. Now, there's a wide variety of what is normal, but they might be low. They might be under 100 systolic. That's that top number, right? They might be under 90 or 80, and that would be pretty low. All right, so also the heart rate might be sped up, all right? That's tachycardia. So their heart rate's fast, their blood pressure's down. The heart speeds up because it's trying to compensate for low blood pressure, right? You have less volume circulating in the plumbing. Blood pressure drops. To supply the same amount of blood, the body thinks, okay, we'll just pump faster. Well, that only works to a point. That's compensation. It doesn't work forever. All right, so where are we? All right. So we've assessed for signs of shock, and that just tells you, you know, where are we? Kind of gives you an idea of how far along this road we are. And plus, when you go to hand over a patient to, the next level of care, you can at least, tell them, hey, slide into shock, or it's not shocky yet. All right. TCCC will tell you the first thing you're going to want to do is, after you've stopped the bleed, okay, you've assessed for this, assess for signs of shock. Now you're going to want to start an IV or an IO. Intravenous therapy. We've all had an IV probably at some point. Or IO, intraosseous. So that would be a catheter, basically a needle into a bone. Typically, we go into the sternum or breastbone, or into the tibia, bottom of the leg, lower leg, and we can infuse fluids or blood that way. All right. So again, you're not going to do these things, and I'm not telling you to go do these things. Unless you're trained and you know what you're doing, you should not be starting IVs or starting IOs, right? But this is what the algorithm will teach us. All right, so you start the IV, you start the IO. That gives you access to provide both fluids, whether that be blood or crystalloids, also medications, all right? So again, sliding down the algorithm, we've got the IV or IO. The first thing they will tell you to do, if you're within 3 hours of the trauma, is tranexamic acid or tranexamic acid, TXA. See, right? TXA is essentially, it's been used for years, mostly in the OR. Women with very heavy menstrual periods sometimes would be on it. It's basically it's a medication that keeps the clotting from breaking down. So basically, essentially, you clot better. Your body will clot better. So if we clot better, we stop bleeding, right? So that's the goal here. So tranexamic acid is the first medication TCCC tells you to give. So you've stopped the bleed, you've assessed for signs of shock, you've got an IV or IO, you give TXA, right? And TXA again has to be given within 3 hours. The dose is 2 grams. They mix that in 100 milliliters of NS or LR, and you infuse it. All right. So you give that tranexamic acid, that TXA in, and basically your body will clot better. You stop bleeding. All right. The next thing to do, and arguably the most important, is replacing the volume that's been lost. If you've lost a bunch of blood from a gunshot wound, blood all over the floor, soaked your clothes, all over the ground, you've lost, whatever, a couple of units of blood. Let's say you've lost 300, 400, 500 cc's, milliliters of blood. You've got to replace that, right? The best replacement is whole blood, right? There's a kind of stair step of what we want to give. Whole blood is best because whole blood's got, that's just like we take blood straight out and give it, right? As long as it all matches, cross matches, and all that stuff. But whole blood's got all the clotting factors, got the platelets, it's got everything the body needs, right? So whole blood, then you can go to packed red blood cells with some fresh frozen plasma and platelets. You keep sliding, you keep moving down. This is based on what's available for the most part. Eventually you get to things like colloids. Colloids are just fluids that expand the blood volume. And then at the very bottom are those crystalloids, those clear watery fluids like we're all familiar with in the ER, right? Normal saline, lactated ringers are usually the two that we use. Usually lactated ringers, obviously, honestly. And TCCC will say if you're giving crystalloids, you're giving in boluses of about 500 cc's. All right. All right. So stop the bleeding, assess for signs of shock, start an IV or IO, TXA, replace volume. All right. Replacing volume, again, whole blood is best. Okay, another one simple point about shock, all right, and normal blood pressure. You're not looking for a normal blood pressure. If you're giving, let's say you're giving, all you've got are crystalloids. All you've got is lactated ringers, so you're giving a couple boluses, you're giving 500 cc bolus of lactated ringers. You're watching, are there signs of shock getting better? Are they getting a little less confused? Is their blood pressure coming up? Is their heart rate coming down? We're not looking for a normal blood pressure. All we want is, if you were taking blood pressures, you want to have their systolic, that top number, be about 90. Above 90 is good. That means you're going to be perfusing the organs, right? We want to perfuse the heart, lungs, kidneys, brain, vital organs, all right? All right, last but not least, you want to keep your patient from getting cold. You want to keep them from getting hypothermic, right? And that is great because this leads us into our next video, and we're going to talk in the next video when we continue the March PAWS acronym. When we get to H, H is head injury and hypothermia. So under C, keep your patient from becoming cold. That it really falls under H, but follow me. In shock, you want to keep them from getting cold, and we'll tell you why in the next video. So stick around. All right. People always ask, well, can they drink fluids? All right. What the TCCC tells you is that if they're fully awake, they're making perfect sense. They have no airway problem. They're not having problems swallowing. They have no trauma to the head or neck, GI tract. Right. They haven't taken a round to the belly. And they can swallow completely awake. Yes, you can give them oral fluids. All right. Be careful. Make sure they're not falling asleep and aspirating on it. Water into whatever you're giving them to drink into the lungs can cause other problems. All right, so that's it for today. That is C, circulation. Really, we're talking about shock here. In the next video, we'll continue March PAWS. Like I said, we're going to cover head injury and hypothermia. Again, I'm Rich Kutchman with Strategic Self-Reliance and Defense. Thanks for watching. We'll see you next time.